Welcome back to the Morning Times on TVG Channel 28. It's an absolute pleasure to have Dr. Ghazi with us this morning. Good morning. He is the director of the Cancer Institute of Guyana. So, good morning to you.
Good morning. Pleasure is all mine, actually. I'm specifically director of outreach at Cancer Institute. I don't want
Thank
to
you for that.
Yes. There are a couple of other directors.
Director of outreach.
Yeah.
Okay, so thank you so much for coming because I know you're a very busy man, especially around this time with, breast cancer awareness.
Oh,
Month.
believe me, I'm busy around the year.
Around
This month
the
is
year.
cancer awareness, but let me tell you, I see cancer patients around the year, 24/7.
Yeah.
You know, people are suffering with cancer. It's just that we have the hype in this month,
Yes.
but is cancer not there in other months or other days? Of course it is, right?
Of course. So this month is basically, aimed at, providing awareness.
Breast cancer
and that's
awareness,
the most
right,
important
right,
thing.
right.
So tell us, we'll go very basic with what are some of the symptoms?
I mean, it's, if you feel any discomfort in the breast, if there is a puckering of the nipple, if you feel lumps or masses in the breast, if you have discharge coming out of the nipple, these are all symptoms, and people have heard of them for many times. What I want to stress is that people have to understand that there is a monster out there. And the monster is there, and we all have to join together to fight this monster. I mean, it is the second commonest cause of death due to cancer, right?
Yes.
And a woman is suffering a lot, especially Caribbean women. It's very common in Caribbean countries. So we have to join hands, corporate businesses, people, and everybody to create awareness. To ask our neighbors, you see a woman more than 40 years old, tell her to go and have a mammogram, right? 20 years and above, tell them to, like you were talking, I was hearing about the physical examination. They have to learn. It's not like, physical examination is not like feeling, what is wrong there, but there is a specific way you do it. You can learn it from the nurse or a medical professional.
Yeah.
Yeah, definitely. So it's really and truly all about the awareness and just getting everything out. So what role do you think the community should play?
I mean, community has to understand that these people who have cancer are needs their attention. Community have to help them. There are a lot of issues with a breast cancer patient. There are psychological factors. If a patient is living in a home, right, she might have a normal life before the breast cancer, but breast cancer brings a lot of psychological tensions and problems on that patient. And people have to understand it, give space to that patient, be kind to that patient, and understand that he is the same family member who was there before, and help in every way possible, monetarily and physically, to have that person screened and treated. And also the responsibility of the corporate businesses and media is to bring this issue out and help people fight with this cancer. Every year we have more survivors now, thanks to the media, okay? Thanks to the awareness campaigns, walks. We have more people now surviving breast cancer than before.
Due to early detection.
Early detection. And early detection, like you said, physical examination, mammograms, ultrasound. The Cancer Institute of Guyana is a pioneer in providing radiation therapy for cancer in Guyana, right? 10 years ago, we started it. But what I'm saying is, the people who are there, the woman who is watching this show, I really want to ask you to take advantage of the facility available at Cancer Institute. We are running a campaign this month that mammogram and ultrasound. There is a new trend in the screening, which is called sonomammogram. You come, you have a mammogram and an ultrasound. Both are necessary to locate and to classify breast cancers, right? Before biopsy, right? We are giving it away for $5,500. Normally they are more, $5,000 each. But if you get it separately, it is $3,500 now during this month. But we are joining them together, giving this package $5,500. You go to Survival or any restaurant and watch a movie. Young woman
you end up spending that
right,
much.
that money. So why don't you spend that money to save your life?
Yeah, that's an excellent point.
Right.
A lot of money is used on a lot of meaningless stuff that we do during the course of a month.
Yeah.
Putting aside $5,500 to save your life
Right.
is really how you have to put this, right?
And also, I mentioned to you earlier that we're going to be giving out, free screening vouchers. So, guys, remember to, message us on Facebook.
And you were saying mammogram. Let me tell people. Okay, we combine mammogram and sonogram, and it is only 5,500, which is the cost of the mammogram. So when you come here with that coupon,
Yes.
we'll give you a sonogram and the mammogram.
Yeah, that's fantastic.
Right?
So another thing I want to talk about is it's actually very rare, but men also 1% of men. 1% of men?
Yes, I mean
Can get
of course. I
breast
mean,
cancer.
you already talked about it, but
Yeah.
what 1% of men? I just saw a little boy just yesterday who has gynecomastia. Like people tend to connect it to something. Oh, he had a fall, and since 2 months he's having a swelling. But it was gynecomastia. It's a hormonal thing. Men can also have some big breasts, right?
Yeah.
So men can also have cancers, but luckily men suffers 1%. But we are here to talk about the 99% of the women suffering, right?
Of women.
Of women.
Definitely. So there is also the Nestle Pink Ribbon Walk, which
Yes.
is very, very important for
Yes.
the community and Ghana at large to be involved in. It is going to happen at the Demerara Cricket Club, and gates open at 2 p.m. and walk starts at 3:30 p.m. and registration costs $1,500 with the purchase of 2 packs of Svelti milk, and that entitles you to the commemorative pink T-shirts as well as the support button.
Right, and Nestle and Cancer Institute of Guyana has partnered during this month in fight against breast cancer. And I'm very grateful and thankful to the Nestle, that they have taken this initiative. And you can call the Cancer Institute 225-5701 to get registered for that walk. And I would appreciate people to come forward. It is not only the people who are suffering with breast cancer or who are like the relatives of breast cancer patients or breast cancer patients. It is for everyone, like you were saying, how community can help. I want to see that stadium full, packed with people coming together. Like, this is a war. Yeah. This is a war against cancer. We talk about this army and that army on the borders. This war is inside our country. And we have to join together to fight this war. How can we fight this war if we don't come together to show our unity, against and strength against this monster? So let's defeat this. Like I said, live, don't die. You have to give that message out. Everyone, every neighbor, every relative, bring that slogan to the stadium there. Live, don't die, because we want everybody to live a healthy life.
Of course, and having a healthy diet and a very active lifestyle is very important.
Of course, it is not only for breast cancer. It is true for every condition, every disease of the body, right? You have to have a healthy life. You have to have a healthy nutritional balance. You have to feed yourself right, and you have to do exercise. Just 1 hour of walking in the morning, brisk walk can reduce your cholesterol, can control your sugar, instead of going on insulin and other things and, worrying about what causes cancer. Yeah. Just go out in fresh air 6 to 7 or 5 to 6 in the morning and, brisk walk, and it would clear your mind also, keep you active. You don't need a coffee.
Definitely. We actually have our coffee, which we love. But, it is very important to be active. Kian, have you been active?
Not as active as I should be.
And I'm sure you're very active.
Yeah,
as well.
I do a lot of things.
You do the brisk walking in the morning and stuff? Yeah. Did you do it this morning?
This morning,
you skipped because of the morning times?
Yeah. I live near Parika, and that bridge, man, it kills me. So I'm here. Luckily, I made it quick, and I was here 45 minutes before the program.
Yes, he was. He was here actually before Kian.
I was taking a brisk walk.
Yes, you were taking a brisk walk. I like that one. Dr. Ghazi, it has been an absolute pleasure having you on the program. Thank you so much for doing what you do and dealing with patients and really supporting them.
Well, thank you very much, and I really want to ask people to just think about it. that somebody in your family is suffering or somebody not in your family is suffering, it is a humanitarian thing. You have to come out. You have to help these people. You have to help them screen. If somebody don't afford, Cancer Institute has I founded a foundation there. We help people. If you don't have money, you have to fill a form, and just we want to make sure that genuine people are getting it, and we will help you with funds also. If somebody needs treatment, radiation therapy, chemotherapy, we don't let anybody go out, untreated. And similarly, I request the corporates to come forward, donate generously in the Cancer Foundation of Cancer Institute, and help treat these poor people who don't have anything. Sometimes they don't have any food to eat, no clothes to wear, and they come and sometimes they die without treatment, so help them out.
Definitely, definitely. Dr. Ghazi, it was an absolute pleasure having you
Pleasure
on the
is mine.
show.
Thank
Hope
you
you
very
have a
much.
fantastic day.